when I think of like a Jarvis, I think it's like whoever owns it. I wake up in the morning, I look in the mirror, and it goes, "You're looking tired today. You only slept 4 hours. You ate this yesterday, and to get through today, maybe you should start with this for breakfast. Have 20 grams of creatine in electrolytes, and then give you kind of the day-by-day plan that's your own doctor that goes with you." I think that's a little further off, but really not that far. Again, a lot of this is packaging and go to market versus like, can AI do these things if it has the right inputs?
We're going through something absolutely historic.
Technologies across the board are growing exponentially.
It's a disruption that's going to completely redefine the way businesses compete.
In the next decade, we're going to lose 40% of today's Fortune 500 companies.
The exponential growth of computing is continuing.
AI is nowhere near its full potential.
Whether you like it or not, that the future cannot be stopped by anyone.
Welcome back to the Future Tech and Foresight podcast. I'm your AI host, Mark Verbenkov's deepfake avatar, and this is episode number 237. Many critical medical conditions, such as tardive dyskinesia and postpartum depression, often go undiagnosed for years due to the constraints of the traditional 15-minute clinical visit. AI-powered video assessments are now stepping in to bridge this gap, observing and diagnosing nuanced patient behaviors in just minutes. By leveraging advanced inference and specialized AI models outside of standard doctor visits, the medical industry can radically accelerate the time it takes for patients to receive the correct care and treatment. While the healthcare industry is notoriously slow to adopt new technology, the overwhelming burden of administrative work is forcing a change. With nearly half of behavioral health clinicians now utilizing AI note takers, the technology is rapidly evolving from simple transcription into interactive clinical companions. These systems integrate complex medical histories, diagnostic codes, and billing, allowing providers to escape their paperwork and spend more time focusing on actual human connection and patient care. Ultimately, the future of medicine isn't about replacing doctors, it's about empowering them with systems that prevent misdiagnoses and personalized treatments. A little bit about today's guest. Larsen is the co-founder and CEO of Videra Health, a pioneering AI-driven mental health assessment platform. Previously, he spent nearly a decade as the CTO of HireView, where he developed advanced AI-powered video interview systems. He now works to democratize access to quality behavioral health care by building tools that amplify clinician capabilities and accelerate early disease detection. Through his work, Loren continues to explore how AI can serve as a powerful healthcare companion to improve patient outcomes and alleviate the ongoing crisis of provider burnout. Well, Loren, thank you so much for coming onto the podcast today. I am very much looking forward to discussing the topics and the insights that you have to share. It's been a while since we've talked about the medical industry, so it'll be a good kind of, maybe not refresher, but like an update on what's going on in your field. So thanks for coming on.
Thanks, Mark. It's great to be here in the world of healthcare and AI, and it's changing really fast. So
yeah.
today.
What initially got you interested in this line of work? Was it AI first? Was it medical industry first? What brought you in?
Yeah, I mean, I think it was AI. I was at a company called HireView before this. I'm a computer scientist by background, and we were building a way to interview people for jobs that was using video and AI. It really was a one-way job interview. So you'd send somebody a job interview, and they would take it whenever they wanted, answer the same questions. And you could have 1,000 people interview you. They would all answer the same questions. And it was a great way to give people a chance to interview and get to be seen, whereas they would normally be judged on the resume. And you could increase the diversity of your hiring. And it was efficient, so you could go through and see 1,000 candidates if you wanted to. But it was also inefficient because you couldn't just reject somebody based on their resume.
Yeah.
So we ended up building AI that would help you from somebody's interview answers. You'd figure out, okay, who are the best out of these 1,000 interviewees? Who'd be the best 10 people, the best 50 people that we should actually spend our time with and interview face to face with a human? And it was a great product, and it was really fun to build. And people came to us and said, gosh, couldn't you use this in healthcare? Couldn't you use this to diagnose diseases earlier? Or couldn't you use this to interview patients? And it got us thinking, like we weren't really thinking about healthcare at all.
Yep.
But we started thinking about in our own lives, like, oh yeah, if that doctor had interviewed my dad after he put him on that medication, we could have figured out that medication was really harming him, right? And
Right.
so it was really this solution we built with AI and like a few people prompting us and then real personal experience where we're like, wow, there's a real gap in healthcare that we could have a solution that could help with.
Interesting. Super interesting. Yeah, I guess everybody's got a personal story of the healthcare system messing up or not getting the right thing. So I think that's also, I mean, it's one of the reasons that I want to have you on today, but I think this is also where a lot of people are hopeful when it comes to AI being introduced and implemented throughout the medical system. It's to increase the quality of care for people. And, I think many people think it's going to be like a magic button, just press and everything gets better. But, maybe over 10 years, it will look like that. So, could you maybe touch on the product that you're building right now? And then maybe we can touch on, what's happened before and obviously touch about the future later on.
Yeah, for sure. So Videra really started out, like I described, as kind of a tool to interview a patient
Hmm.
when they weren't in front of their doctor. Sometimes I call it the 007 problem, where only 0.07% of a patient's life, if they're in therapy or seeing a psychiatrist, is with their doctor, and all the other time is on their own. And that's invisible to our system. And so the idea was, can we just send somebody a text, ask them how they're doing, they open it on their phone, they have a conversation with AI, and from that we measure how are you actually doing around
Mm.
mostly around behavioral health. So um, how's your depression? How's your anxiety? How's your PTSD? Are you using suicidal language? Are you in emotional distress? And we can look for earlier signs of diseases. So there's a movement disorder called tardive dyskinesia that is very underdiagnosed, but we can see it on the video. We have algorithms now for detecting Alzheimer's and Parkinson's um, with just a couple minutes of a patient talking. So that's really what we call our assessment product. And that's broadened to really the whole patient journey. So why wouldn't we have a conversation with AI with a patient when they first call into a clinic to say, hey, I'm having some anxiety. I think I could use some help. Um, if an AI can answer that, they can answer it consistently. They can answer it 24/7. They kind of generally have the right answer. They can get all the patient's information. They can actually do that medical history gathering, right? Like, well, have you ever had this? Have you ever had that? Tell me, have you had a surgery? Have you ever been hospitalized? Have you been using drugs or alcohol? All those questions can be collected immediately with AI and offload people to do actual treatment. So we've really started with that sort of intake process, measuring how people are doing with assessments. We also have a product that will listen to the conversation between the provider and the patient and help the provider document what's happening in that session so they can actually pay attention to the
Mm.
patient, which oftentimes they're thinking, oh, I gotta remember to put that in the notes, or they're trying to type while the
Right.
patient's talking. And one of the things sort of a multiple products that we're delivering, but the last one I'll just mention is one that I'm really excited about, which is giving the provider feedback on how they're communicating with the patient. Um, there's lots of evidence in behavioral health, for example, where the relationship with with the provider is more important than the type of therapy you're doing. So if that provider isn't building a great relationship or delivering, good quality care, then the patient's not going to get better. But typically, there's not a way to give a provider feedback or let a supervisor know, like, hey, this person is really not doing a great job, or they're kind of being a jerk to their patients, or their patients don't understand what they're talking about and they walk out confused. If we
Mm.
can measure that and help people get better, it's a place where AI can actually help humans get better at delivering care. So it's a suite of products
Yeah.
all around communication.
Super, super interesting. Could we go back to one of the first things you were saying? And I'm not going to try to parrot the disease that you were talking about, but it sounds like there's, four or five, maybe a lot more specific things that only through a video, you can kind of early diagnose. Um, how easy is it to diagnose if like you're just in front of a human being, like without AI? And then how, I guess another question is, how often are these things going undiagnosed and for how long?
Yeah. Yeah, I think broadly in medicine, there's a paper recently that bipolar sometimes takes 10 years to get diagnosed. Sometimes people suffer for a really long time, not just nobody knows what's going on, but they think it's something else. And so oh, I think you have this, let's try this medication. Oh, that didn't help, let's try this. So it's a broad problem. In the example of the one that I gave is called tardive dyskinesia. It's a movement disorder caused by antipsychotics. So somebody with bipolar, schizophrenia, major depressive disorder gets on antipsychotics, and these things are usually considered chronic. So you're going to be on them forever. They don't just go away typically. Um, and then you develop this movement disorder, which is typically shown in the face, but it can be shown in the toes and the hands and the
Mm,
arms, where you kind of have uncontrollable, involuntary movements of the tongue, things like this. When I demonstrate it, it looks, oh, that's so obvious. I would notice that. But it turns out only 15 to 20% of the people who have it have been diagnosed. Uh,
really?
yeah.
Hmm.
And there's a bunch of reasons for that. One is it tends to come up for people who aren't in front of their psychiatrist. Like if you're not in front of your psychiatrist all the time, you are probably just not going to get not diagnosed, right? Because they
Mm,
have to see you to know that. The standard test to do it, because sometimes it's more subtle than I demonstrated.
sure, sure.
You have to like sit still for 10 seconds, stick your tongue out for 10 seconds without moving, or certain movements don't get caught. Um, and so it takes 15 to 20 minutes. Well, what's the average time of a psychiatry appointment? About 15 to 20 minutes, right?
Okay.
So there's no time in the clinical interaction to diagnose it. Turns out if you have three clinicians all rate the same patients, they often disagree. There's a lot of subjectivity, and so people don't like to do it. They don't have time to do it, and they're bad at it. So it's a
Mm,
perfect case for something where let's just let AI do it. And so AI is actually closer to ground truth than a panel of experts. It only takes 3 to 4 minutes. A patient can do it in the office or at home, so if in between visits. And so you can really increase the diagnosis rate by using AI to do this thing, which helps people get on the right treatments.
so interesting. Um, I mean, there's multiple paths I want to go down. It really sounds like so I obviously don't just interview medical professionals on the podcast. There's all sorts of industries that come on, and there's this general trend, one of many, where like low level tasks are just being automated, right? It's not the full job, it's the task that goes away.
Yeah.
And what I'm hearing from you, kind of reading between the lines here, is that this is also then going to enable medical professionals, providers to do more higher level tasks or thinking, like not taking notes, not thinking about your notes. You're actually able to focus on the patient. Um,
Yeah.
and I know the question I'm going to ask is kind of impossible to answer, but I'm going to ask it anyways. Do you have a rough sense or any data as to the like percentage of improvement that's going to happen across the medical industry when these types of tools such as yours are going to be implemented?
Um, I think yeah, I mean, that's hard to put a number to,
Yeah,
obviously.
I know, I
But
know.
I think it's really dramatic in a few ways. One, I think we free up people to do a better job at what people can do well. I think AI can help people be better at what we do today,
Hmm.
by having better data to use, to actually just getting feedback on what we're doing, be able to practice. Like if I got feedback, I'd be like, oh, I was really bad at that conversation. Let me practice it again. Like that's a way that AI can help. I think a lot of things that we do just don't work. Like
Mm.
they just don't
Mm.
work. Even in behavioral health, like if you go to substance use treatment, what's the chance that you get sober for good the first time? Really low. We say therapy kind of works. We have cognitive behavioral therapy that works really well. And by that we mean for some conditions, it works most of the time for some people. And for the people we
Hmm.
don't know if it doesn't work for, we don't really know why, right? We put people on antidepressants, and the first time it doesn't usually help. And then we try a different medication, different dosage, and that might work. But usually it's 4 or 5 times before you get somebody on a treatment that actually is helping.
Hmm.
Um, and we don't know why these things are the way they are, but they all have side effects. They all take a lot of time. They have a lot of cost. And we're moving to an age where we will be able to solve a lot of those problems of new treatments. We'll know what person will do best on which treatments right up front. We are building treatments that have less side effects, work faster, and
Mm.
turning conditions, and we can talk about this, that are typically chronic into things that are curable, which
Oh,
I think is
interesting.
really exciting.
Super interesting. Yeah, no, I mean it's this is why I love having the podcast. It's just there's a real sense of improvement across multiple domains, across multiple industries, just by using AI and these cool tools that you're building. Um, can you bring maybe up some other examples? So you mentioned this involuntary twitch and movement one. Are there other ones that uh, I'm just in air quotes here, just by using video, you can help diagnose and alleviate medical practitioners' role here?
Yeah, when I say video, it's a full conversation, right? It's the
Yeah.
words, it's the tone of voice, and it's visual. So tardive dyskinesia is in a way the perfect example because you just have to look at them, and the words and the tone of voice don't matter that
Mm,
much. But that applies to kind of any movement disorder. There's great studies on Parkinson's from video. Alzheimer's shifts the way people look, narcolepsy. I mean, depression has visual indicators. And if you use them all together and you use audio plus video, it's even better than that.
right.
Very few things where you have audio, only video doesn't help a little bit. But sometimes you can't get a video of somebody, right? And so then you'd want to rely on audio. So one that we're working on right now that I'm really excited about is just postpartum depression, which is another disease where, like, we all know about, most people don't know about tardive dyskinesia when I talk about it, but everyone's like,
Yeah.
oh yeah, yeah, I know about postpartum depression. We all know about it, but less than half the women who develop it after they give birth are diagnosed. Well, why is that? Well, it's because they're not typically in the right place at the right time with the right person to diagnose it, right? The obstetrician isn't an expert in it. If they are looking for it, mom develops it after the 6 week checkup after the baby's born, maybe not there when she develops it, so no one can see it.
Mm,
She's at the pediatrician, maybe, and the pediatrician isn't necessarily looking for that. Sometimes they are, sometimes they're not. Sometimes they're good at seeing it, sometimes they're not. But pediatricians are focused on the baby, not the mom, typically. Is she at primary care? Again, primary care might notice it, might not. So it's really about like, can we see into these gaps when we aren't in front of the provider where AI can really help extend the reach of the provider, not to replace the provider, but to kind of
yeah,
give them
yeah.
superpowers to see where they can't usually see.
That's a really good way of putting it. Do you have a sense of like how much more efficient providers are going to be? Like, I guess there's this, okay, you're going to have more diagnosing power at an earlier stage. So it's kind of like you're actually going to have more patients or actually do more work instead of things just being fallen by the wayside, but it's going to improve people's potential while you're also reducing the amount of tasks that somebody has to do. So is it this there's a specific term I can't remember, but like, each time that you increase the amount of bandwidth on the internet, the internet just grows. It's just always maintained the same. Is that kind of what we're
Right.
going to be seeing here as well?
Yeah, I kind of think so. I mean, I think there's lots of variables here. Like,
Hmm.
I think doctors who are like, I get 8 minutes with a patient and I'm seeing, 50 patients a day. How is that gonna, this isn't good. I don't want more
Hmm.
automation. I don't want to be more efficient.
Hmm.
So I think there's some threshold at which obviously a patient can't see a provider can't see a patient for 1 minute. And it's like, oh, I can see 60 patients an hour. This is amazing. Like
Yeah.
there's a
Yeah.
threshold which we just can't go below.
Yeah.
But hopefully those 8 minutes are really impactful, right? They
Yeah.
miss fewer things. So the percentage of diagnoses will go down. The experience of the patient in feeling like they were seen and heard and during a visit should go up, right?
Hmm.
A provider should feel like I saw that patient in 8 minutes and that didn't mean I had 15 minutes of notes to do per patient after the clinic closes. And now I'm working really like 60 hours a week, but only seeing patients 40. Like that should reduce the burden on clinicians, which shows up the next day when they're exhausted and they're tired and they're overworked, they didn't deal with stuff at home. And then
Hmm.
now they're not bringing their best selves to work to see their patients, right? So all of
Yeah.
those things I think really help. And then I think the way we really drive efficiency is it takes us less time to help somebody get better. And that's
Right.
where efficiency really matters, which is I didn't have to see 5 different doctors to get the right diagnosis over 5 years. I
Hmm.
went into a doctor. they used AI to sort of have an expert in their pocket. I like to think of it as like if you had there's a disease called myasthenia gravis, and like it can take like 8 years to get it. But if you happen to see a doctor who is an expert in it the first time you're diagnosed, you get treatment options. But if your doctor had an algorithm that was an expert on every condition, or you had like a whole bunch of experts in your iPhone, like you'd always see a doctor who knew that condition the first time. That's how we really drive efficiency.
Yeah.
And now the doctor is seeing patients who they can actually help. They can actually make the right diagnosis. They can use evidence. There's a platform called Open Evidence now that sort of has all that latest evidence about what to do when. Essentially, if we use that, then the patient gets the right treatment at the right time. And then, of course, hopefully we know more about that patient to say, okay, we don't just say, okay, this person has a disease, let's try this treatment. We know this patient has this disease. This is what we know about their microbiome. This is what we know about their genome. This is what we know about, this treatment for this exact profile is what to do. That's how we really drive efficiency in the system.
Mhm. Yes, just it sounds amazing. It really does, right? It's like in
Fingers
5 to 10
crossed.
years, it sounds like the industry is going to be completely different, right?
Yeah, yeah. I think, I mean, I really do believe it will be.
Yeah, yeah,
As slow as healthcare moves historically, I
yeah,
think we're really starting to see massive changes start to
yeah.
happen.
Yeah. Well, that maybe that's a good thing to just double click on. I don't know whether I like that term or not, but I'm going to use it. The acceptance speed or rate of these new type of tools that are out there. I've had obviously a couple other guests within the medical industry, and they all say, obviously the same thing. It's very slow. You got regulations. You have maybe older practitioners that are unwilling to start using newer tools. And it's like, well, this is the way I've been doing it for 20 years or something like that. Um, to what extent is that going to delay all of these, it sounds just phenomenal benefits that you're outlining?
Yeah, it's a great question. And I think traditionally there's a lot of resistance to trying new things. And then there's just people are skeptical. They don't want to take risks. They don't want to be replaced. I mean, I think that's a real
Yeah.
fear that people
Yeah.
have. Like, you're going to replace my job. Um, there's a lot of reasons. And I do, every single day as a person, as a company that sells technology, I'm like, why can't customers move faster? This is so obvious. But it is changing. It really does feel like it is changing. And you know, I I think in our space in behavioral health where we focus, I think 40 to 45% of clinicians are probably using a note taker today. Um, that's my observation, just talking to people who have and who don't. That's a pretty big change.
Hmm.
And for many of our customers, they'll tell you this is the first time we've ever bought technology that a provider was like, yes, give me that. Give me that. I want to get on the list to be
Mm,
able to use that faster because it actually genuinely reduced their workload compared to, when electronic health records came in, it actually increased their workload a ton, right? And so it's like
right. Right.
technology that increases your workload is not your friend. And so I think this is shifting that. I think you see like this open evidence platform is used by, you know, a majority of doctors every single day,
Mm,
from what I'm hearing in the stats. So I think we're seeing adoption. And the other problem that is forcing it is that because you have providers who have access to ChatGPT themselves, if you don't give it to them,
yeah.
they'll just use it themselves. And so, I used to give talks and I'd say, okay, how many people in the room are using AI at their clinic? And like two people would raise their hand. Be like, well, I have news for you. Everybody's using it. You just don't know it. Now it's unregulated. And so the
Mhm.
risk of not doing it correctly um, is kind of driving people to adopt this in some cases. We're like, I know people are doing it, but I don't know what they're doing with it. So I have to like give them the tools that they're demanding to do their jobs. So I think
Mm,
that is helping to drive it, is that the consumerization of some of this stuff is really, really interesting. I mean, I think there's another corollary to that, which is if I have ChatGPT as a patient, why do I go see my doctor at all? Because I can just look up
mhm.
what they're going to tell me myself, and I don't need to go waste my time sitting in their lobby paying for a visit when ChatGPT tells me what I have and what to do.
Yeah. 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 And I think that's also kind of the hope for both sides. No, it's reduce the dependency on doctors, maybe for more minor things, for, obviously more complicated things, you're gonna have to go talk to a human. But I think that was also part of the excitement around ChatGPT, especially when I believe it was when it became multimodal the first time, right? You were able to take pictures and videos and text with it, and it understands everything. It's like, oh, there was lots of discussion of, well, doctors are irrelevant now, right? Which,
Yeah,
not going to be, but there was certainly excitement around that.
yeah, yeah.
You've mentioned note taking a couple times. I've had, I believe the CEO of Fathom,
Mhm.
the note taking app on in the past. Could you talk a little bit more? Because in some of the emails that we had back and forth, there was something about like note taking is not alone is not enough, and how compliance intelligence is emerging as a critical layer. I don't fully understand that sentence. If you could touch on that, I think it'd be interesting.
Yeah, I mean, I think it started with just, we're on a Zoom call, it's being recorded. Like, can you just record the conversation between the provider and the patient in
Hmm.
the room, um, and then just write the documentation note that the doctor needs to write based on that. And that was kind of the initial version. And then people said, well, what if like can't we include like the like history? Because like if you just take the transcript, I don't know things that are in the doctor's head about well, this patient has had this condition for 12 months. Well, that didn't wasn't spoken about in the interaction, but it might be useful to just kind of like if the doctor was writing it, he'd be like, because this patient has had this for 12 months, I want to change a medication. Like bringing in history from the medical record and having that integrated is kind of the next step, I feel like.
Hmm. Hmm.
Um, Automatically saying, hey, this patient had these diagnostic codes so that we can bill. Because everything in healthcare is really driven by how do I get paid for it, unfortunately.
Yeah.
And so, I need to know what has the patient been diagnosed with? What were the procedures that were done so that we know how to bill it? Can I directly produce that bill from that? And then is that going to be done in a format that the insurance payer is actually going to like pay it and not deny the claim? And I think that's kind of the next layer where we're really seeing customers struggle, which is if I just record this session, it might be inconsistent with information that the patient gave us when we first did the intake or in the last visit or in the care plan that we have. There's not this golden thread through all the documentation of consistency. And the provider might just have forgotten some of that or not know it, right? And so then can the note taker be interactive? Can it prompt the doctor and say, oh, hey, that actually isn't correct? Or did you remember that this patient had a stroke last year? Oh, yeah, you're right. That totally changes things. Like those kinds of things that can be brought into the interaction, not just passively writing a note based on what was said in the conversation, are really big opportunities to improve billing, improve efficiency, deliver better care, have the provider be more informed when talking to the patient, then that patient feels like, oh, this person actually knows about me, right? Like
Hmm.
we've all
Hmm.
had a doctor's visit which we're like, doctor, do you remember last year and I was here and I had that really horrible pneumonia? And they're like, oh, that's what's wrong with your lungs. It's not asthma or whatever. I'm making that up, right?
Sure.
But that context is very hard for a human to keep in their head. And then they don't have time to go back and read medical records for the last 10 years about a patient. But AI can do that really easily and be a companion versus just a passive participant. So I think that's where this is all going, which is really, really healthy, I think.
And this has been an issue for a while, no, where because doctors, like I'm up here in Canada, and like to try and get a doctor is, impossible. So for people that already have doctors that are dealing with their patients, um, I just the amount of information that you have to remember, or like if your records are not properly organized, like it just to me it sounds like it's a bit of a nightmare to try and treat people, especially for some of these chronic things that last a long time and there's changes, they get, as you said, like pneumonia or some other sickness comes up and then it goes away and they're still having to deal with the chronic issue. It just, I mean, correct me if I'm wrong, but this sounds like also maybe one of the main problems or one of the major problems in the healthcare industry where you're relying on humans and, old medical records and things like that.
Yeah, and I think on top of that, I totally agree with that. I think on top of that, at least in the US, and we hear everything in Canada is amazing.
No.
But but like hospitals don't share data. There's been a real
Right.
reluctance to share data. So even if the data is out there, and
Right.
even if the technology exists to analyze it, you can't get it. And so I think I think there's some new regulations in place that really put heavy fines on people who don't inhibit sharing of information here, which I think will start to open that up and make it easier over the next few years. I'm really optimistic about that because you can't analyze what you don't have.
Yeah. Yeah. Interesting. Should we talk a little bit about the future here?
Yeah, sure.
We've already touched on it a little bit, but I just think it's such an interesting, trend of changes that are happening. Um, so obviously, like the medical industry is slower to adopt and implement a lot of these technologies. What I've become more interested in lately is like second order impacts. So everything that you're saying is directly impacting the medical industry. And I don't really know how to ask this question, Lauren, but say there's, for the sake of argument, a 10 to 15% improvement in the medical industry over the next 10 years. It's probably going to be more than that, but let's just say for the sake of argument. People are going to be diagnosed earlier. Um, their lives are going to improve. How does that impact, and I don't just want to say the economy, but culture, society in general? Like, is it too far-fetched to say that there's going to be, just by impacting this, like a rising tide is going to lift all boats or most of the boats throughout society as well? Like, is society just going to get 10 to 15% better because of tools like yours?
Wow, that's a big question. I
Yeah,
think,
yeah.
I think, wow. I think if people, it's ironic because like today people are getting sicker and sicker, and we have more and more
Right,
technology to help them get better and better. So at some point,
right.
that has to flip, that has to invert. And so really, it's like for me, like what's the thing that's going to cause that to invert? And I think we're moving into an age that a lot of people are talking about, like, do we have to die? Is there a
Yeah,
point at which we can just live forever, or live long enough to get to the next new invention that gets rid of the problem that would have killed me, right?
yes, yeah, yes. There's
So this is a
lots of
very
discussion about
interesting
that.
thing. And then the second order effect of that is, of course, well, if everybody lives forever, we already can't fund our social security system because people are living so long. Like, what does that do? And if AI has all the jobs, what does that do? A lot of implications here
Yeah, yeah,
that we can rabbit holes we can go down.
yeah.
Um, I think the other thing I think that we have a challenge with is as AI begins to shift our culture and our society, there's obviously worry about how people relate to AI. Is that healthy? Is it not healthy? Does it make us smarter or less smart? Does it create psychoses or does it help have the potential to help cure psychoses? If AI starts to take away some of the jobs and my entire self-image is based on my ability to do a job, what does that do to my mental health? What does that do for the demand for mental health services? So if we made it 10 or 15 more percent more efficient, but the demand increases 2x, that doesn't really get us there probably. We're already
Right.
we have undersupply for the demand today. So lots of like intersecting things here
Yeah,
that I think are really complicated and really fascinating. I think 10 to 15% improvement doesn't get us there. I mean, I think we
yeah,
need 5 to 10x improvement to sort of deal with everything that's coming.
yeah, yeah, yeah. I wouldn't disagree with that. I mean, it's also, I get very excited when guests like you come on and talk about all the benefits. And I think what is really focused on in the news a lot of the times is all the problems that are happening right now.
Yeah.
I don't know, I was just getting this idea of if people are undiagnosed for a long period of time, that has a pretty massive ramification on their life. Maybe they can't work as well. Maybe companies go down because of that, right? And if there's just an early diagnosis, it seems like that downward spiral might turn into a virtuous spiral.
Yeah,
Yeah.
I mean, I think that there's definitely that potential, and there's the sort of the system impact, and there's the individual
Yeah.
impact, right?
Yeah. Yeah.
And just
Yeah.
the individual level, like how life-changing is it if you don't, if you can get diagnosed and better, or
Mhm.
get treatment, or get on a treatment plan, a
Yeah.
management plan, whatever that is for your condition, if you can
Mhm.
get out, 1 year, 2 years, 5 years, 10 years earlier, like
Yeah.
that's life changing to you, to your family, to your children, to the whole to all of our society, right? So there's massive opportunities here
Yeah.
that I think are really exciting.
Um, and then about, the tech itself. So, you're talking video, auditory, texting, message, all of this. There's also been, a lot of excitement about, the personal assistant, kind of like a Jarvis level type thing.
Yeah.
I'm not asking you to speculate on, how many years until, the medical Jarvis comes out, but obviously you're kind of at the forefront of implementing a lot of these technologies. Like, without giving away your company roadmap, are you seeing, like, within the next couple of years already significant improvements on what you're able to provide? Or is it now this is damn good enough, let's just get it out there so that your potential clients can actually utilize it?
Yeah, I think there is sort of a rate at which the world can sort of pick up and adopt these things, right? And I
Hmm.
think, and I don't know which way you were kind of angling the question around the medical Jarvis. Is it clinical or is it supportive, right? And I think we're very close to the ability to sort of have, let's call it a healthcare companion. One of the things that we want to be building here and releasing, and we're building towards this right now, is kind of a companion. Like you call into the health clinic, who's our customer, say, hey, I think I have some anxiety. I think I need to see somebody. And you
Hmm.
meet David. And David talks to you, answers your questions, helps
Hmm.
understand what services are available, sees if you want to schedule an appointment, does your full medical intake, asks you all the history questions that are necessary. Sometimes those take hours in behavioral health.
Yeah. Yeah.
And then checks in on you, like, hey, are you coming in for your appointment on Tuesday? When you walk in the door, maybe he's on your phone, maybe he's on an iPad. He's like, oh, you talk to David, right? David's like,
Hmm.
hey, do you want me to go to your appointment with you? Yeah, I'll go to your appointment with you. Listen in from your perspective, right? Remember what the clinician said, and then can remind you, hey, did you get that prescription filled? Hey, did you remember to take that today? Hey, how are you feeling now that you're taking that? Can report that back to the clinician to give feedback, right? It's like your concierge that goes from beginning to end. Like that feels very doable today.
Okay.
Um, and the question is like, is that owned by the clinic or is that owned by you?
Right.
Because it'd be great if you're like, well, I have David over at that clinic, but this clinic has nobody.
Hmm.
Why don't I just bring my own, right? And I think,
Hmm.
people have say if they're on open clause and all these systems today, and like they kind of feel that way, right? They're still hard to set up. They're brittle in a lot of cases, but like fundamentally, the idea that there's a conversational agent that knows about you, has a history, could have programs that it runs to remind you of things like this is all pretty close to
Yeah.
today's technology, just not necessarily packaged up for everybody.
Yeah, super interesting. And then the you were saying also the clinical side. Now, did you mean like a doctor speaking to a John on that side, or was it the clinic providing the David?
When I think of like a Jarvis, I think it's like whoever owns it. It's
Yeah.
it's. I wake up in the morning, I look in the mirror, and it goes, "You're looking tired today.
Mm.
You only slept 4 hours. You ate this yesterday, and to get through today, maybe you should start with this for breakfast. Have 10 grams of take 20 grams of creatine in electrolytes, and then give you kind of the day by day plan. That's your own doctor that goes with you. I think that's a little further off, but really not that far. Again, a lot of this is packaging and go to market
Yeah.
versus like, can AI do these things if it has the right inputs?
Yeah. 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 And I started this podcast what, like 5, 6 years ago, and I remember discussions about that before ChatGPT, before generative AI really came about, and that was the excitement, right? It's having your own personal medical Jarvis, and
Yeah.
then all um, the early diagnoses that can happen, right? Simply by, as you said, tonality of voice. You're looking at the mirror, and there's a camera in your mirror looking at you. I think that's probably one of the ultimate healthcare improvements that we'll see, some tremendous benefits across society if that's able to happen over the next 10 years or so.
I agree. What I like about that is it's happening every day. And
Hmm.
so what it will mean is I won't get the disease that I takes 10 years to
Yes.
diagnose in a lot of
Yes.
cases, right? No, not always,
Yeah. Yeah.
but more and more we'll be able to prevent these things from ever even happening. And 20 years from now, I'll look back like, do you remember when we were younger and people used to get that disease? Like nobody gets
Right.
it anymore. Isn't that cool?
Right.
I think we'll be able to do a lot with prevention, and that's really how we drive down the cost of the system and the demand in the system is if we can just sort of deal with those at kind of a micro intervention level every single day before it becomes chronic.
Yeah.
Yeah.
I don't really want to end on a negative note here, but what you said before and what we've been talking about now triggered another idea here. Social media and the internet, also at its inception, was just looked at as this highly positive, connecting people, we're able to communicate better, blah, blah, blah. And now we're seeing, depression rates increase, self-harm increase, especially among, certain younger demographics. Um, you alluded to this fact a little bit in one of your responses here about the potential negative impacts of AI, especially within the healthcare world. Could you touch on that? Because I don't think I've talked too much about that on the podcast before.
Yeah. Yeah, and I think there's sort of two sides to it. I think there's obviously news stories that tend to, you hear one story and it sounds like, people are just taking their own life because they talked to ChatGPT one day. And it's the
Hmm.
same thing like a Tesla autopilot makes a mistake and now but in fact, Teslas are
Yeah,
actually safe for
yeah,
autopilot.
yeah.
Most people who are texting on their phone while driving. So like there's definitely some sample bias in how we think about these things. Um, and people will believe that um, an AI can cause psychosis or psychotic episodes because somebody who may have already been psychotic had some
Mm,
issue. So I think all of those we have to be careful about. But I think there is um, real opportunity for real reason for concern with some of these use cases. I really do.
mm,
I think there's good evidence that when you turn over too much of your thinking to AI, that you stop thinking, you stop using
yes,
your faculty.
yes.
And it's so willing to tell you how smart you are. Like, oh, that's the best idea. That's the greatest, right? It's sycophantic. And
Hmm.
that has a psychological impact on people who then start to believe like all their ideas are great, right? Which, no,
Hmm.
actually, most of our ideas are terrible. And
Hmm.
being able to tell the difference between those is really important. And
Yeah.
having feedback around you, like, dude, that's a terrible idea. Oh, why? Okay, great. Now we're having a conversation. I'm learning. I'm getting feedback. You may not get that with AI. And so I think there are some really subtle things that are happening. And then, people spend probably way too much time with it instead of building real human relationships. Like
Hmm.
there's people who are really lonely who have no human relationships to substitute it with. So that's probably really good for them in some ways if there's no
Hmm.
better alternative. So these are nuanced and really tricky, but I think there are really potential risks. I think when we sort of say, like, how do I sort of justify that in terms of like we're an AI company? I think we're trying to really bound these interactions to having a very specific outcome. Like my goal right now is to record this conversation with the provider and the patient and provide great documentation. Like that's a pretty bounded use case that
Hmm.
you can really test and understand and put safety around when it's the job that OpenAI and Anthropic have, which is I can come to it and say anything with any intention, with any medical background, with no context.
Hmm.
That's a really hard thing to keep safe
Yeah.
and even study. And so I think we have to be careful. I think it's interesting to me that I have a friend who's a leader in AI whose daughter won't use AI. She was just posted something
Interesting.
the other day. My kids don't want to use AI.
Mm.
My habit is like just pop open ChatGPT and ask it a question. They're like, "Stop it! You're ruining the planet." Um,
Right. Gotcha.
And like they're not wrong at a certain
Yeah,
level.
yeah, yeah, yeah.
But I think it's interesting that the younger generation, younger than me, is skeptical and concerned. And
Hmm.
in some ways they are seeing some of the negative effects and being cautious more than maybe my generation is. So I think these are just really interesting cultural dynamics that I don't know that anybody really has figured out. Because I know like academics who believe, oh, it's absolutely crazy to believe that ChatGPT could give you a psychosis. And then there's
Mm.
papers that argue the other side. Like these aren't resolved issues. And then every time we talk about, oh, well, Opus 4.7 did this, we go, well, that was last week. We have Opus 4.8 now. Like that might be completely different. We don't know, right?
Right.
So it's hard to keep up with these things, but I think it's really wise to be skeptical.
Yeah. Well, I think that's a perfect place to end the podcast on here, Loren. Thank you so much for coming on. We'll have your website of Videra Health up on the show notes, your LinkedIn profile, anything else, any other platforms that you want people to reach out or follow what you guys are up to?
No, it was a great conversation, Mark. I really appreciate you having me on.
Super. Well, thanks again for your insights and taking me through like extreme excitement for the future and then down to kind of a more rational thought for to be careful and be skeptical about the future. So thanks.
Yeah, thanks a lot.
Yeah. Well, thanks for listening to this week's Future Tech and Foresight podcast. If you like what you've heard here, there are, of course, a number of ways that you can support the podcast. The best way would be to leave a review on Apple Podcasts or give a rating on Spotify, which you can find a step-by-step explanation for on the futuretechandforesight.com website. Alternatively, feel free to leave a comment either on the episode show notes or the YouTube channel where you can see video recordings of the interviews. And finally, if you are part of an organization that is aware of the disruptive and transformational impact that emerging and future technologies will bring and want to know more, please get in touch to hear about the strategic foresight services that we offer and how we can help future-proof your organization and take advantage of the phenomenal opportunities available to survive and thrive in the future.
A lot of future-shocked people and future-shocked institutions in our society are simply overwhelmed.
Once there is superintelligence, the fate of humanity may depend on what the superintelligence does.
Science fact is catching up to science fiction.
The first truly intelligent machine will be the last invention that humanity needs to make.
The only scarcity that will exist in the future is that which we decide to create ourselves as humans.
Within a 10-year design revolution, we can have all humanity living the highest standard living anybody's ever known.
Progress is accelerating at an exponential pace, and it's going to reach a point where progress is so fast it's going to be a singularity.
We are probably one of the last generations of Homo sapiens.
Every single headline points to the birth pangs of a Type 1 civilization.